Our group published a paper very recently, actually, in Hematologica, discussing this very topic. We have a large practice in our hospital, and based as it is in central London, but receiving referrals from a wide field, more or less the whole country. By definition, we see an ethnically diverse group of patients. And so we did look at our data, and of the 1,400 odd patients that we have on our database, 1,200 had documented ethnicity associated with their record. But we had to exclude a few because there was incomplete data, or the diagnosis was revised to something else other than WM. But within that group of 1,168 patients, 110 were from ethnic backgrounds. But I guess one question is, how do you define ethnicity? And I think different countries have different definitions of ethnicity, and certainly different categories. The UK census system uses a certain set of categorizations, and because we were dealing with the UK population, that is what we used. And in our paper, there is a supplementary table delineating what those are. But briefly, of the 110 who were of ethnic origin, 58 were Asian, which includes people of South Asian and Southeast Asian origin. 17 were Black. 6 had a mixed ethnicity, and 29 came under the other group, which I know is somewhat confusing, but I guess reflects the reality of ethnicity, because there is, increasingly people get together with people from other ethnic backgrounds. So this is something for us to be aware of going forwards. I guess briefly what we found was that patients from ethnic minorities appeared to present at a younger age compared to those of white ethnicity. They tended to have a lower presenting IgM paraprotein, and the mid-88 mutation was less frequent amongst the ethnic groups compared to the white groups. Now, we have to say always with retrospective studies that, there may be selection bias and other pitfalls in analyzing such data. But I think there is a hint of significance in different aspects when considering ethnicity. And in fact, in IWM 12, we went on to describe further some of these social deprivation characteristics of patients in the UK, and that was presented as a poster at IWM 12. And that used something called the Index of Multiple Deprivation, which is an established measure of relative deprivation in the UK. And again, there were some signals from both the ethnicity data and the social deprivation data, which I think is early days to draw firm conclusions. But what our data, I think, underscores is that it is very important to look at these data, collect them in a prospective and consistent fashion, so that both in real world and clinical trials practice, so that we can better make sense of what this diversity actually means for patients in terms of their biological characteristics, but also how they may respond to treatments and how the disease may behave in general. So that is something I very much am in favor of doing, and would recommend that to all my colleagues across the world.